Hi, my name is Dr. Richard Antbring. I am a sport and exercise medicine consultant. I work in elite football, private practice, and the NHS in London. I'd like to talk to you today about the TFCC injuries, which are also called as Triangular Fibrocartilage Complex injuries. Now, the TFCC contains ligaments as well as a disc, and that disc sits between your wrist and your hand. This is similar to a meniscus of the knee, and it helps to stabilize the wrist as well as to distribute force. It's commonly injured in weightlifters and gymnasts, anyone that might compress or have rotational movements throughout the wrists, and also if someone might fall on their outstretched hand, they can injure the TFCC. Often they present quite late, as patients think that they're normal wrist sprains, but they usually heal very slowly due to the poor blood supply to the area. The symptoms that one might have with a TFCC injury is, for example, pain on the pinky side of the wrist, or sometimes the pain might be diffuse and all over. Often the pain is made worse by weight bearing or doing movements such as handstands or hanging. You can also notice it while doing rotational movements such as turning a doorknob or holding a frying pan. Other symptoms might include clicking or a feeling of weakness throughout the wrist. So to diagnose a TFCC injury, there are a range of clinical tests that might be employed in clinic, but also the diagnosis can be helped by using ultrasound as well as an MRI to look inside for the soft tissues inside the wrists, such as the ligaments and the disc itself. Together with the degree of symptoms that one might have, this can help us guide further management, whether this can be simply conservative, so coming on to treatment, which is the most common way of managing this, is to use a splint, especially in the acute period after the injury, where we might seek to just immobilize and settle the inflammation. Further down the line, as the inflammation settles, we'll use more functional splints that allow people to use their wrists in a more normal manner and less restricted. Should there be a significantly severe injury, which can be suggested by the MRI scan, as well as the degree of and longevity of symptoms, we will think about using other modalities as well, such as corticosteroid injections, and we might also involve the opinion of an orthopedic surgeon, as an arthroscopy can in some cases be helpful. In terms of regaining functional strength, it's very important that we do a set of exercises and get hand therapists to be involved as well, in order for us to reduce the risk of injury in the future as well. So in summary, TFCC injuries are actually fairly common injuries and can sometimes be thought as simple wrist sprains. They need accurate and concise diagnosis in order for us to be able to manage this in the best possible way and reduce loss of function and risk of re-injury in the future.